Not yet.
There you go, Sunny. That was a magical appearance, yeah? Hey. We'll see. Here's Olivier.
Your bikes are we just made it. Chris, we're ready when you are. Are we ready? Yes.
Good afternoon, everyone. Thank you very much for this regular press briefing regarding coronavirus disease, COVID-19. Today we will have our Director General, Dr. Tedros, calling us from Kinshasa. Before we give the floor to Dr. Tedros, I will just say what I say most of the days, that journalists who are watching us using Zoom, please click raise hand if you want to ask questions. Those who are dialing in by phone, *9 and then asking questions. Dr. Tedros will be on the screen that is on the side in this room, so people who are watching online will be able to see Dr. Tedros. Those who are watching us on Twitter may not be able to see Dr. Tedros, but everyone will be able to hear him. We have with us Dr. Mike Ryan, Executive Director of WHO Health Emergency Program, Dr. Oliver Morgan, Director of Health Emergency Information and Risk Assessment, and Dr. Sylvie Briand, Director of Global Infectious Hazard Preparedness. I will now try to get in touch with WHO Director General Dr. Tedros. If you can hear us, please, you can make your remarks.
Yeah, thank you, Tariq. Good afternoon, everyone. I am speaking to you from Kinshasa, Democratic Republic of the Congo, as Tariq said, where I have met with President Tshisekedi, ministers, UN colleagues, and other partners to review the impressive progress that has been made towards ending the Ebola outbreak and to talk about future plans to ensure that everyone in the DRC can access quality health services going forward. And attention focus on strengthening in the country's health system and bolstering preparedness. Whether it's Ebola or COVID-19, investing in preparedness is the smartest way to ensure disease outbreaks are identified and stopped quickly. I'm glad to say that countries around the world are in a better state of preparedness for COVID-19 than they were just a week ago. And WHO's efforts to help countries boost their lab capacity continue. Now, the latest numbers on the COVID-19 outbreak. As you know, China has changed the way it reports data from Hubei province. There are now a total of 47,500 laboratory-confirmed cases in China and 16,437 cases that have been clinically confirmed in Hubei province. Illnesses, including influenza, are not getting mixed into the COVID-19 data. In total, there have been 1,381 deaths in China, including 100 reported today. Outside China, there have been 505 cases in 24 countries and 2 deaths. China has also released data on infections among health workers, which stands at 1,716 reported cases and 6 deaths. This is a critical piece of information because health workers are the glue that holds the health system and outbreak response together. But we need to know more about this figure, including the time period and circumstances in which the health workers became sick. WHO guidelines have been developed for health workers taking care of hospitalized adults and pediatric patients with acute infections. These guidelines have been made available to all countries.
As I said the other day, we have been in regular contact with suppliers, asking them to prioritize production and distribution of personal protective equipment to health workers on the front lines. We are also in touch with member states on this important issue. I'm glad to say that the WHO-led joint mission with China on COVID-19 is moving forward. We expect the full team to touch down over the weekend. The mission consists of 12 international and WHO experts and a similar number of national expert counterparts from China. The China mission will include in-depth workshops, a data review with the principal ministries, a series of meetings with key national level institutions, and field visits in 3 provinces to understand the application and impact of response activities at provincial and country levels, including urban and rural settings. The goal of the joint mission is to rapidly inform the next steps in the COVID-19 response and preparedness activities in China and globally. Particular attention will be paid to understanding the transmission of the virus, the severity of disease, and the impact of ongoing response measures. Furthermore, it will be important to review which type of information is needed so that the world can use this window of opportunity to prepare health systems and workers for possible outbreaks. Clearly, this is an evolving picture. Health workers and responders in China are working with virtually no sleep in difficult conditions, but we need to ensure that we're getting the most accurate data as quickly as possible to assist China and support the global response. We're working with our Chinese counterparts on these issues, and this is also part of the scope of work for the WHO-led joint mission with China. Finally, I wish to thank Cambodia, especially the Prime Minister, for demonstrating to the world the meaning of solidarity. While other countries turned away the Westerdam cruise ship, Cambodia allowed it to dock. Today, hundreds of passengers are disembarking and are en route to their home countries. 20 passengers who reported signs of illness have tested negative for the coronavirus COVID-19. I hope that other countries will follow Cambodia's lead. Lastly, I want to say again from my heart that this is the time for solidarity, not stigma. There are warning signs that the world is not hearing the call for unity and standing in unison with those at the epicenter in China who are saving lives and alleviating suffering. I again repeat, this is time for solidarity, not stigma. This is time for solidarity, not stigma. I thank you.
Thank you very much, Dr. Tedros. Dr. Tedros is calling from Kinshasa, so therefore the sound was not the perfect, but we were able to hear everything and to get the messages from Director General. Those calling through phone, it's *9. Those who are on Zoom. Yes?
If I may say, as you know, I will be taking my flight shortly, so I may not be with you until the end, but you're in able hands with my colleagues. So I hope you will allow me when I'm ready to leave the room to catch my flight. Thank you.
Of course, Dr. Tedros, thank you very much for being with us.
To catch my flight. Thank you.
Of course, Dennis, thank you very much for being with us. *9 for those dialing in by phone and clicking raise hand on those on Zoom. We will start obviously here in the room as we do every day. Here we go. 1, 2, 3, and then we will go online. Yes, please.
So a commentary published weekly by the Lancet said that many of the travel restrictions lately implemented by some countries during the COVID-19 outbreak violates the international health regulations, which is the legally binding system for protecting people worldwide from the global spread of disease. So Dr. Ryan, what's your comments on that? Can those restrictions be considered as violation of international law? Thank you.
So, Dr. Tedros, if you feel it at any moment that you would like to answer, please just jump in. Dr. Ryan, maybe you want to take this one.
Okay. Yes, WHO has been clear on its advice to our member states regarding travel and advice to travellers and travel and trade restrictions. It's important to remember, though, that the temporary recommendations issued by the Director General under the IHR are actually not binding under international law. What's binding is that countries shall provide a public health rationale for the use of those measures where countries exceed them. So it's I know it's a pedantic point, but it's very important to make it. We try to set a general guidance that allows countries to act in good faith with that guidance in place. Countries may act to exceed that guidance as long as they are able to justify that in public health and make a public health rationale for having taken those measures. In the end, sovereign countries are responsible for the health and welfare of their citizens, and as such they make risk assessments for their citizens and apply measures that they perceive that protect their citizens. And as such, once they are within their own legal national framework, then the IHR is silent on that. The issue is whether or not they are in a position to share with us the justification for that. And that's what we've been doing, is following up with each and every country and asking them to provide us with the public health rationale. Why have you done this? What was the evidence for this? How long will these measures be put in place? Will these measures stop or prevent people travelling in a free manner? And that's our job, and that's what we've been doing.
Well, Dr. Tedros, if he wants, he will add something, and if not, Christian, Gunilla, and then Jamie, and then we will go online.
Can you please there's a little button.
Okay, thank you. I have a very fast two-part question. Can you enlighten us on the 12 international members of the team that is going, and how long is this team going to stay in place? Is it going to Wuhan? And the second question is, was there any advice to Japan on the Olympic Games?
Thank you. I forgot to mention that we would really appreciate to have one question per journalist.
Mm-hmm. Maybe I can start with the second question, and the Director General may wish to input on the international team. We're constantly in touch with the organisers of major events. In fact, we have long-term collaborations and have had in the past with major mass gathering organisers. We work every single year with the authorities that organise major religious festivals like the Hajj. We've had teams working for almost every Olympics and World Cup in the last 2 decades in terms of risk management. So we are very much engaged with those institutions and with those events, and we will and obviously offer them any support and technical advice as to their own risk assessment and risk management regarding COVID-19. At this stage, there has been no specific discussion or no specific decision made regarding any of those mass events in the coming months. But we stand ready to offer both member states hosting events and organisations organising events to offer them the best mechanism and risk assessment approaches that we have.
Thank you very much. Maybe Dr. Tedros would like to answer the question on international team.
So the first question was not clear. The second question, I will start from the second and you will tell me the first. For how long they will stay depends on, the scope of work they will have there. So they will adjust based on the need for them to stay. But I'm not clear about the second question. I'm the first.
Composition. So Christian is asking if we can give more details on the composition of the team.
The composition of the team, it's experts from different countries who are really good in the area of expertise which is needed. And for now, we prefer to keep it as such, but we will give you more information about the experts whenever it's necessary.
Thank you very much, Dr. Tedros. Gunilla, and then Jamie, please, one question.
Yes, hello, Gunilla von Hall, Swedish, Svenska Dagbladet. I have a question on the medical... Yes, hello, Gunilla von Hall, Swedish, Svenska Dagbladet. I have a question on the medical workers, 1,716. Do you consider this figure credible? Are you worried it's actually more? And how worried does it make you feel, especially now when you have more people coming to hospital as they have a large definition? And if I may add to that, the ones who get ill, infected, and then recover, do they have immunity for life?
I will start on this question, but I will hand over to Sylvie, who has maybe some important messages to health workers around the world on the implications of these data. The fact that there are over 1,700 cases amongst all of the cases of COVID is very sad news. But we've seen this before with MERS, we've seen this before in SARS, we've certainly seen it with hemorrhagic fevers. What we need to be able to do within that, and what we are doing with Chinese authorities, is exploring the time period over which those occur. Our understanding is that the cases amongst health workers peaked in the 3rd and 4th week of January, and there's been a rapid fall-off in the number of cases that have occurred in health workers in the last 2 weeks. This may reflect increased levels of training, increased levels of protection, and also increased levels of awareness. Remember, this outbreak has expanded very quickly in an unsuspecting health system. So we also need to look at how many of those health workers were exposed unknowingly within a clinical environment, and how many were wearing protective equipment, how many had training. There's a whole load of factors we need to look at. And we will be doing that with Chinese authorities. But if you look at the percentage of the overall number of cases, in fact, although it is still it's a very tragic situation for those health workers, and particularly those who've lost their lives, and our heart goes out to their families for their courage. It is a lower percentage than has occurred in other coronavirus outbreaks. Now, that's not a guarantee that it won't change, and clearly, but what is clear is that we've always known that health workers are in the front line. We've said on many, many occasions here that the real front line and the real point of entry for a virus into a country is a busy emergency room, an unsuspecting general practice clinic. So we have called again and again for the training and equipment of workers. The Director General has called for a prioritisation of protective gear for those workers because we understand those risks. And again, we do believe that it is possible to manage patients with the coronaviruses very safely with the proper training and the proper protective equipment, and we need to send a reassuring message out there. And Sylvie has much experience with this, and she may be able to give more context for the messages we need to send to our health workers, because they are our front line, they're our heroes, and we need to be very careful in how we message around this issue of infection.
Thank you, Mike. And indeed, so we had this data, and now we are really discussing with Chinese authorities to understand what has happened. Although it's not unexpected or unusual, because we have seen this in previous outbreaks, but it's very important to understand if it has happened in the emergency ward, or if it has happened when they were treating patients, or somewhere else within the hospital facilities, so that we can also target and target implementation of corrective measures. What also is very common in epidemics, especially when people are working 24/7 and they are under a lot of pressure, is the fatigue of the staff, and probably the peak coincides with the time where people were already exhausted and maybe they have not been as attentive as they should have been on infection prevention and control measures because they were too tired. But we have learned that Chinese authorities have sent a number of other doctors from other provinces to continue to support hospitals in Wuhan and help the health workforce. But we know that, as Mike said, is that health workers are always at the front line. They are the first one to see the index case, the patient, and so they need to get prepared. So we have first developed a training package for them, and you will find it on Open WHO, our massive online open course platform. And we are also having dialogues with more than 40 international medical and nursing associations to make sure that the advice and recommendation reach most of the healthcare workers. And so we are. It's a process, ongoing process, and we have a teleconference next week to discuss with those people.
And immunity when you recover? Sorry.
Yeah.
Yeah, we don't. Obviously, it's too early to tell what the immunity profile will be. We really don't. We don't have a serology test even to test for immunoglobulin response yet. So it's going to take time, and it's impossible to know. But we would expect that recovered patients would be protected from having another infection. But for how long that protection lasts, or whether that protection covers other coronaviruses, is impossible to say at this point. That's an item for immediate research. Yeah. But again, important to recognise when we say recover patients, and when patients are discharged from hospital, they're swabbed before discharge. Many are tested negative, and it's really important that we don't start creating stigma around discharged patients. When patients are discharged from hospital, they are considered to be fully recovered, and as such should be welcomed back into their communities with open arms. They're survivors, and they should be seen and welcomed and celebrated as such.
Thank you very much. Dr. Tedros has left his office in Kinshasa, so we will continue with our speakers here. Jamie, and then we will go to journalists online.
Can you hear me? Can you hear the microphone?
Yes.
Okay. Hi, yeah, Jamie, Associated Press. I'm sorry, I just wanted to follow up really quickly on Christiana's question about the Olympics, because that is a major concern. And the Tokyo authorities said apparently that you guys had told them that there's no reason to call it off, but there's a lot of people in China that are afraid that they may not be able to fully participate. But that's not my actual question. My question is, could you please respond to what was said by Lawrence Kudlow about China? As much as you said many nice things about how China is responding, there was criticism from Larry Kudlow at the White House saying that China is not being transparent and they're disappointed that the United States has not been invited in. So what do you say to that? Thank you.
All the easy questions, Jimmy. We have not offered advice to the IOC for the Olympics one way or the other, and neither would we. It is not the role of WHO to call off or not call off any event. It is the role of WHO to offer technical advice, to support a considered multi-layered risk assessment around the event, to offer advice on risk reduction and risk mitigation measures, to offer advice on risk response measures, and it is the decision of hosting countries and the organising agencies to make that decision. So let me be clear, and we are continuing to do that. Will continue to do so for each and every event that is of interest. We are a member state organisation. We are there to support our member states and support our partners at large internationally in that endeavour. So I don't know Mr. Kudlow, but the question is about access for response within China.
Transparent.
Yeah, well, transparency about access with the team, Jamie, or transparency with...
I mean, but he's criticizing, he's disappointed that there's not transparency and that they haven't been invited in.
Mm-hmm. Well, it's opinions and speculation. We've been very clear on the fact that we've had a team on the ground, as our WHO office has been there since the very beginning. Our country representative and a team were in Wuhan weeks and weeks and weeks ago. So from our perspective, we have a government that's cooperating with us, that's inviting in international experts, that has shared sequences with the world, that continues to engage with the outside community, that has published again and again and again in credible international medical journals, that continues to make international presentations. So I'm finding it hard to square that with Mr. Kudlow's comments. But everyone is entitled to their opinion, and everyone is entitled to suggest evidence for their opinion. And if there is any clear indication of why there may be some determination of lack of transparency, we'll be very glad to have that discussion. With regard to the international team, I believe we will have US experts on that team, so we will have to wait and see. So let's see what the next few days and weeks bring. I think the other thing to reflect upon is that there's been a deep scientific collaboration between institutions in the United States and around the world with institutions in China over the last increasingly over the last 20 years. It's really interesting to me that the major scientific coordination organization in China is called the China CDC. I wonder where they got that idea. So, I think people need to recognize that scientists collaborate regardless. They get on with it, and they've been collaborating, are collaborating, and will continue to collaborate. This is a very obviously a tense political environment because of the economic issues and because of everything else. Please, let our scientists get on. Let our public health professionals get on. Let them work together, and we find answers to this. And as the DG said, maybe we should try, all of us, to avoid politicizing this situation right now.
Thank you very much. Let's try to get a few questions from journalists calling in. Do we have a New York Times online?
Yes, hi. This is Ronnie Ribbon from the New York Times. I know you are... Can you hear me?
Yes, please go ahead.
Yes, please go ahead.
Okay. I know you are still trying to get more information about how the healthcare workers were infected and what the circumstances were, but will you consider upping your recommendations in terms of the PPE they should be wearing and adhering to the CDC guidelines, which call for respirators, not surgical masks? And that's just one question.
Thank you.
Thank you.
Thank you for that. Thank you for that.
Thank you for that.
You want to take it on?
Well, I think, again, I mean, the PPE is one element of protection, but more importantly is how you use the PPE. And we have seen in many occasions for very dangerous pathogen that even with highest level of PPE, you can still get infected because of inattention and mistakes you do when you are tired or when you are not being very careful on how you handle this. And we have seen this in Ebola outbreaks. Some healthcare workers, even with the PPE, were still got infected. So I think the discussion is more on how can we make sure that healthcare workers feel safe, and also how we ensure that they use properly the PPE they have, and when they are doing specific procedures where maybe a respirator is necessary, that they can have access to it. But when it's not necessary, and there are many times when you take care of patients where it's not necessary to have such equipment, then they just need to use what they have the best way possible. And sometimes we have seen as well that having a PPE that is very sophisticated can give a false sense of security, and then people forget even the most basic basic things such as wash your hands when you are finished. And I think that's why it's very important to not disentangle the equipment from the people, because these are protections, these are shields that need to be used at the best and not rely only on the equipment.
Yes, and just to follow that and to maybe use the analogy, equipment and safety equipment is very important. But if I were to hand any of you scuba equipment and ask you to jump in the sea right now, you might be very nervous. The equipment is not what makes you safe. It's the equipment in the hands of a trained professional. And we need to focus on training and behavior just as much as equipment.
Thank you very much. I know that we have Nina here in a room, but someone from AFP is online, so let's try to get that one.
Hello?
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 Hi, it's Dario Hubert from AFP.
Hi, Dario.
Dr. Ryan, you told us about the things that China's got right in the response to this virus. I was just wondering, do you think there have been any mistakes at any level in China in the response? And do you think there are lessons we can draw about future public health emergencies? Thank you.
Yeah, I think there will be lots of lessons. We're doing that right now in DR Congo, and just completed a peer-to-peer review of our performance there and the performance of other agencies. And the time for that is not now. But there isn't a single emergency that I've been involved with that we haven't learned something from, and China and the rest of the world will learn many lessons from this. Well, at least will learn, and I hope implement the lessons of this. One of the tragedies of global response and public health response in general has been the fact that we don't tend to learn the lessons from response, or at least we don't tend to implement the lessons that we've learned. So no, but I won't go into. I mean, yeah, you lot have been telling us about all the things you think are wrong with the response, so maybe you should answer that question. But no, I won't go into the details. It is not the time for us to start public recrimination. Everyone needs to focus on their performance now, and they need to focus on getting the job done. And the last thing you tell to someone that needs to get a job done is that you didn't do your job last week or the week before. That doesn't support performance. What supports performance is getting people to internalize how they can improve and get on and do it. So we will have that discussion, and we will learn the lessons, and we are constantly in touch with our colleagues in China and the other countries. But we will wait for any forensic investigation of this response until we have achieved further success in containing this virus, we hope.
Hello, let's take, we have a question from Hong Kong. Can you hear us, and can you introduce yourself? Sorry, we don't always have names available.
Hi, can you hear me?
Yes, can you please introduce yourself and ask one question?
Okay, this is Marianne Benitez from Hong Kong Standard newspaper. I'd like to ask you, the Hong Kong Chief Executive Carrie Lam this afternoon said they're planning for logistics and preparing quarantine facilities to evacuate some 2,200 Hong Kong people out of Hubei province from 30 cities, and about 200 more on Princess Diamond ship off Yokohama. So would the WHO, based on evacuation by other countries of their own nationals, would have some protocols for Hong Kong to make it a safe procedure, and also how to communicate to the society, because they are up in arms now for the delayed full closure of border points between Hong Kong and the mainland. Thank you.
Thank you, Marianne.
We weren't aware of, I'm certainly not aware of that move, but I'm sure that, as we always do with China and China's special administrative regions, we will always be ready to provide public health assistance and advice for any public health intervention or measure that needs to be carried out. But we haven't received any requests to be part of or to offer advice. And it was very hard to hear the details, but I was hearing that you were referring to some evacuation of people from Hong Kong, from Hubei. So we will, as I said, on request, be able to offer advice on how to do that in an appropriate manner. But in general, we need to be very careful when doing those kinds of processes, because we have to balance the public health benefit around quarantine, about placing people together, some of whom might be infected and others who may not be infected, and we have to be very, very careful in how we manage quarantine, both scientifically and from an ethical and a human rights perspective. So it's an important issue, and it's one that needs to be addressed, but it's also one that needs to be done sensitively, and decisions to make mass evacuation and mass quarantine need to be taken with the best possible public health evidence and with the highest standards of human rights at its centre.
Thank you. We'll go back to the room. We'll take 3 more questions. Our speakers are leaving one by one. So, yes, please.
Doing your job today, Tanner.
Hello, I am Rintaro from Nikkei Japanese Media. My question is about Diamond Princess. Today the disembarkation of the passengers in Diamond Princess has begun, although there are still many people on the board. But some exporter countries criticize that the risk of infection has been increased within ships because getting off a ship was too late. How do you assess about disembarkation at this timing? Thank you.
You know, it's very difficult from this distance to judge public health activities taken in a port in Yokohama. The authorities in Japan are experienced, and they've been obviously looking at that situation over a number of days and weeks, and they've made their public health risk assessments and judgments based on that. Where we've been asked, we've offered public health advice around patient cohorting, around disinfection, around surveillance, around testing, and we've certainly asked that older people on the ship and people with high vulnerability might be allowed to disembark under special conditions, and especially people in inner cabins who don't have natural ventilation. And this is really based on health and welfare of people, not necessarily of that. So we need to balance the health and welfare of the people on that ship, and they are from many nationalities, against the obvious need to prevent any further spread within the Japanese community. And I think the Japanese authorities, I hope, will find the right balance between those two things. We trust through our discussions with them that they are beginning to see that we have to make some arrangements, especially to take care of the more vulnerable people on that ship, especially those who don't have access to appropriate ventilation, etc.
2 more questions, please. One from the back.
Nawaz Shah, Xinhua News Media. Could you please elaborate on the objectives and the content of the database WHO has developed to collect the latest scientific findings and knowledge on the coronavirus? It was in the situation report yesterday.
Yeah. So we are providing a platform, a data platform, so that countries, especially on clinical data from patients, so we need to have a safe place first to have data that are anonymized, but also we need also to make sure that people putting the data are doing it in a way that is standardized, because currently we have some cases in different countries and we need to be able to compare those data. So having a unique platform will enable us to have rapidly more data than if each country develop its own data platform and then we share. And to give you an example, during the 2009 pandemic, we had similar system, but we didn't didn't pay too much attention on the way the data were collected, and at the end we couldn't compare many clinical forms because, for instance, the definition of hypertension was not the same in all countries. So this time we are trying to have really a standardized way to collect information so that we can rapidly compare and go to results.
And we will take the last question, please. Okay, here you go.
Thomas Mueller from Bloomberg News. I was just wondering if you have seen any signals that smoking might play a role in determining the severity of the reaction to the disease, and could this be an explanation for why it seems to be affecting predominantly older people, and there's a bias towards men in China?
I think if you look at any infectious lower respiratory pathogen tends to obviously affect people in their older age, and certainly those with chronic obstructive pulmonary disease are at very high risk of negative consequences of viral infection, and particularly secondary bacterial pneumonia and other things. So it goes without saying that smoking is a risk factor for severity of any lower respiratory tract infection, and we would expect it to be no different here. There is a marked difference between male and females in this outbreak in terms of severity, and there's certainly a marked difference in those habits in China, and it does demark along male and female lines, and it's an excellent hypothesis, but one that is unproven. But I'm sure through the studies and the observations and that are happening, there will be a lot of interest to look at that smoking as a risk factor, and I think it should be relatively straightforward to establish the science on that. Sylvie, what do you think?
Yeah, I think so as well. I'm sure they have collected those information, but analysis has not been yet published on this factor, because most of the underlying conditions that are reported are also linked to a disease associated with smoking as well. So it's very hard to separate the two currently. So I hope that in the near future we'll have more information on that as well.
Thank you very much. We will conclude with this.
What are the numbers? Sorry, just really quickly. What are the numbers for the marked difference between men and women? Can you give us numbers on that?
Off the top of my head, Jamie, really, no. But we can pull them out in terms of proportions. Yes.
Well, we can do that later. Again, so. We would thank our speakers, and then we will have audio file and transcript for future media conferences. We will inform you in the morning. Just one thing for journalists who are online, we had a little issue with some people not receiving our media notifications. We are looking into changing the system. In the meantime, we have a place on our website where we will be posting media advisories, and we will send that link when we send audio files tonight. Thanks to everyone, and have a nice evening.
You are muted. You can mute or unmute yourself by pressing star 6.
At the beginning, but after that it decreased, and now we are more like 50.
Let's go look at our data first.
Goodbye.
Anyone goes calling you off the line. Let's get the number.